Namaskaram to all. First of all, thanks God, my parents, relatives, friends, colleagues, my seniors, juniors, all the participants and leaders of IHPS, IHPF, and my patients. Welcome. Today's topic is all about leukoderma, white discoloration of the skin. It's a meaning of leukoderma is simply white discoloration of skin. Are different types. White discoloration that happens in human body has different types. That firstly, vitiligo, albinism, pityriasis versicolor, pityriasis alba, scleroderma, lichen sclerosis, pityriasis lichenification. Either by absence of melanocytes, cells in skin, or by inability to secrete melanin, produce the condition. Difference of leukoderma, vitiligo, and albinism. First, leukoderma, any condition produce white discoloration of skin is leukoderma. Discoloration due to absence of melanocytes is vitiligo. Then melanocytes are present in the skin but unable to secrete is albinism. Differential diagnosis can possible with a punch biopsy of the affected skin specimen. Human skin in different parts of the world has different hues. The color of the skin is due to a pigment called melanin. Vitiligo is a cutaneous condition, an acquired condition with localized loss of pigmentation of the skin. Melanocytes are special group of cells present in skin which produce the pigment melanin, giving the normal color of the skin, supported by melanotrophy hormone from pituitary. Involvement of protein, role of nitric oxide, melanocortins, and alpha MSH, melanocyte stimulating hormone, are also important. Exact cause of vitiligo remains unknown. However, there are different theories suggesting behind the cause. It is either infectious nor contagious, is only a cosmetic problem, and it tarnishes the beauty of the human body. About 70 million people across the world have vitiligo. There are no boundaries of race, ethnicity, or gender. Anyone, children and adults representing all ethnicities can get vitiligo at any time. Nearly 1% of population is affected with vitiligo. 20 to 35% of patients are children. The parts most affected by this unfortunate disease are near mucocutaneous junctions like the lips, nose, ears, eyes, genital organs, and most of the pressure points. Information we got from different sources are there is no known cure for vitiligo, but the reality is with homeopathic treatment, it is permanently curable. Facts behind the formation of or the origin of the disease is first genetic, then immune, and trigger factors. When explain the trigger factors, first is some viruses cause vitiligo, hormonal changes, that's puberty, pregnancy, and menopause, psychological trauma and stress, industrial chemicals and cosmetics, therapeutic use of some drugs. Trauma of skin again, when observing the trauma of special trauma of the skin, brushing of the hair, cap pressure, washing, makeup, hand pressure, shirt collar pressure, watch pressure, friction activities, etc. triggers the occurrence of vitiligo. Trauma of skin continuation, belt pressure, undergarments pressure, shoe pressure. Trauma of skin again continuation, accidental causes which may be a burn, a cut or an ulcer. Those external factors basically damage the cell beneath the skin which produce melanin, pigment, that melanocytes. Immune factors, autoimmune theory, then neural theory, that segmental vitiligo. Certain chemical secreted from nerves toxic to melanocytes leading to vitiligo. Oxidative stress, excess of formation of free radicals attack melanocytes. Free radicals are everywhere in the air, our bodies and the materials around us. They cause the deterioration of the plastics, the fading of paint, the degradation of work of art, aging-related illness, and can contribute to heart attack and stroke, even cancers. Free radicals are molecules which with unpaired electrons in their search to find another electron, they are very reactive and cause damage to the surrounding molecules. However, free radicals are also useful because they help important reactions in our body, like place, and it can be utilized to manufacture pharmaceuticals, custom designed plastics, and other innovative materials. Essential to a healthy body. Free radicals are utilized by the body to destroy and stop invading harmful bacteria and viruses. If the free radicals are properly controlled, they are very important for the healthy body. Excessive free radicals cause degenerative diseases. Studies and researchers have concluded that free radicals cause degenerative diseases such as cancers, tumors, cardiovascular diseases, Alzheimer's, Parkinson's disease, arthritis, and others. Free radicals deplete the immunity of the body. Excessive free radicals accelerate aging. Free radicals reacts with the body's cell, causing damage to the DNA and hinders cell reproduction. It stops the body from renewing itself, and dying cells are not replaced quickly enough. The consequence is rapid aging process. This is clearly seen in the skin, where excessive free radicals actively cause tangible evidence of skin aging. A lot of cancers are also caused by free radicals due to DNA mutation. Top antioxidants are lycopene, coenzyme Q10, alpha lipoic acid, ellagic acid, vitamin C, and vitamin E. Source is from the spices, herbs, berries, fruits, nuts, chocolates, vegetables. Green tea are high antioxidant values. Then nitric oxide is a molecule that our body produces to help its 120 trillion cells communicate with each other by transmitting signals throughout the entire body. Nitric oxide has been shown to be important in the following cellular activities: help memory and behavior by transmitting information between nerve cells into the brain, assist the immune system at fighting of bacteria and defending against tumors, regulate blood pressure by dilating arteries, reduce inflammation, improve sleep quality, increases your recognition of sense, increase endurance and strength, assist in gastric motility. The most common way to increase nitric oxide is through exercise. Another way to increase nitric oxide is through diet, that is through nuts, fruits, meats, and dietary. Impaired hepatic function has as jaundice, gastric disorder, typhoid fever, etc., predispose to vitiligo. Patients have a history of typhoid fever treated with chloromycetin, which destroys bowel flora. Jaundice and liver affections are also found responsible for those conditions. Suppressed skin diseases, history of repeated vaccination, powerful antibiotics, tubercular infections in the patients and more in the parents, diabetes in the parents or in the patients. Family history of leukoderma in both or either parents, the children inherit the disease. Hormonal changes in puberty, pregnancy, and menopause. The melanocortins are a group of peptide hormones which include adrenocorticotropin hormone and the different forms of melanocyte stimulating hormone, which are derived from melanocortin in the pituitary gland. Psychological trauma, life situations, grief, conflicts of life. In GNM says, Germanian New Medicine says, all diseases are meaningful special biological program originating from shock occurring simultaneously in the psyche, the brain, and corresponding organ. But in my humble experience, observed that genetic causes are predominating, driving, and diverting force that acknowledge systems to decide what disease in which organs to be affected. Also, the same is the governing factor behind the difference in onset, development, and the nature of complications experienced from one individual to the other individual. Homeopathy underlines that fundamental cause of above all is called the miasm. GNM and homeopathy benefits are we can cross-check that any specific exciting cause happens in a period of time before the trigger of the disease. It may, if any situation related GNM theory or not, if observed, we can specifically educate the philosophical techniques to reduce the stress upon that focal sensitivity. At the same time, we can put some special attention to that proper sensitivity on the selection of our constitutional medicine. Without managing the genetic sensitivity and susceptibility by a well-selected homeopathic medicine, resolving the conflict become very hard according to our miasm theory. Focusing the causation ailments from is more applicable in acute diseases, in the treatment of acute diseases, not in chronic diseases. According to homeopathy, the fundamental cause of all chronic diseases are due to miasm, that is from the genetic. That is why our overindulgence in GNM theory by the homeopath become more conflict. Genetic cause, first defect in the gene is the fundamental cause of this condition. Both maternal and paternal incidents experience more susceptibility. Genetic defect of melanocytes is albinism. Non-homeopathic treatment, immunomodulator creams such as protopic, that's a calcineurin inhibitors, and Elitil, it's a cortisone cream, cause repigmentation in some cases when used with ultraviolet B narrowband treatment. Combining vitamin B12 and folic acid supplement with sun exposure cause repigmentation. Narrowband ultraviolet B means narrowband ultraviolet B light is a relatively new technology on the vitiligo front. In the past, most doctors have used the PUVA system. PUVA system means which involves the use of ultraviolet A light exposure. I can contribute something more that the sunrise is the combination of ultraviolet B light and ultraviolet A light. The former days ultraviolet A rays are used for the treatment of vitiligo, but it is found failure. So nowadays it is used to ultraviolet B light for the treatment. the people were with the use of Soralin pills. However, side effects for many people were unbearable with ultraviolet A light. Narrowband ultraviolet B light panels and cabinets solved the problems of overexposure to ultraviolet by maximizing delivery of narrowband ultraviolet B radiation, the most beneficial component of the natural sunlight. Nowadays, it is available ultraviolet, the ultraviolet cabinets and panels. Now, nowadays, melanocytes grafting also popular in the treatment of vitiligo management, but it is highly expensive and in long run, it is find unsatisfactory. Diet, vitamin A and minerals are strongly recommended. Eating dark-colored vegetables such as spinach, nuts, and oats can promote healing of vitiligo. Minimize consumption of alcohol, sour and spicy food. Stress, try to reduce stress level by doing exercise, getting enough sleeps, etc. Sunblock, always put on sunblock when staying outside. Sun damage should induce a aggravate vitiligo. Corticosteroids are still used by the medical profession, but these drugs cannot be given for a long time as it has more side effects. Homeopathic therapeutics. In classification of disease, we can see in acute chronic, in the vitiligo comes in the chronic side. It's one-sided disease and it's a local disease. But the management of the vitiligo needs, like a fully blown chronic disease, so treatment need miasmatic treatment. That is the challenging part of the vitiligo treatment. The disease is more the manifest as a local disease, but the treatment we need is constitutional, like a fully blown disease. The treatment, best treatment for the vitiligo is miasmatic treatment. Specific drugs for vitiligo treatment is Soraliacor, Amivacinega, arsenic sulfate, pituitary anterior, pituitary posterior, pituitary gland in general, then thyroidinum, ledum, Morgan Gardner, ferrum phosphoricum 3x, natron phosphoricum. Soraliacor, Amivacinega, and natron sulfate are nearly specific for vitiligo. If there is no other symptoms is available, it's truly one-sided. Most of the homeopaths try these medicines. Pituitary anterior, posterior pituitary glands. It is used as intercurrent drug when in constitutional treatment, and also the same patient manifest vitiligo patches and also dark hyperpigmented patches on the skin. We can concentrate on pituitary anterior, pituitary posterior, or pituitary gland. Thyroidinum is also a intercurrent remedy. Ledum pal is mostly used from specific from the vitiligo originate from pressure points or from the ailments, chronic ailments after injury, after a burn or injury. From there, the trigger of the vitiligo starts. We can think of ledum pal. Morgan Gardner is a medicine like Cilicia. It is used for malabsorption. If we find malabsorption and malnutrition in that patient, we can use Morgan Gardner. Ferrum phosphoricum 3x is a supportive medicine during the constitutional treatment, especially 3x, because ferrum, giving ferrum 3x, the speed of the pigmentation can modify or improve. Natron phosphoricum is also a supportive medicine. The logic is natron phosphoricum is a medicine for the general acidic nature of the body. The acidic nature of the body can reduced with natron phosphorus, intestinal, blood, and the other organs. So we can give this medicine as a supportive medicine safely with the constitutional medicine. Peculiar from the particular is the other way of tackling the case. It is more, if it is more than one, it is very beneficial. because the peculiar from the particular, that's PQRS symptoms are nearly, the quality of the PQRS symptoms is nearly syphilitic quality. In miasmatic approach, PQRS symptoms are has the syphilitic quality. So we can depend on the particular uncommon peculiar symptom. Constitutional medicine is the another way. A medicine according to the law of homeopathy is the better choice of prescription for the treatment of vitiligo. Then, different pattern of similimum, as the formerly we know, disease similarity is bad homeopathicity. A totality of symptom is good homeopathicity. Patient similarity is better homeopathicity. Personal similarity is also a better homeopathicity. Miasmatic similarity gives the best homeopathicity. So, the best the homeopathic city, the ideal the homeopathic cure. Miasmatic prescription is nothing but identifying the quality of symptoms from the physical, mental, emotional, intellectual, and disease plane, and evaluate in a perceptive of, is it a functional disorder, a structural constructive disorder, distortive disorder, destructive disorder, or degenerative disorder, unpredictable disorder, how fast the progress and what are the nature of the complication, etc. Then prioritize which all are more important for the better survival of the individual. Then classify or prioritize the symptoms in the prioritize the symptoms in the perception, the perceptive of which all symptoms are more destructive and which all symptoms are first to be controlled for the better survivability of that individual, the better survivability of the, so that we have to control or we have to prescribe on the basis of the syphilitic symptoms. In the syphilitic symptoms is the best way of prescription, because syphilitic symptoms are more destructive than the other two miasms. The other way of miasmatic prescription is using fully proven anti-miasmatic drugs, kings of miasmatic remedies, or nosodes like sulfur, zorinum, tuberculinum, tuja, medorinum, merxol, syphilinum, etc. All those prescriptions are benefited to remove the obstacle to recovery from the fundamental miasmatic origin. So the first said thing, that is the said thing that from in the first slide, that is the status miasmatic pattern, and that is the status miasmatic prescription. And the second thing, that is the prescription on the basis of the history, the disease history of the individual, and the other ailments, the disease affected, then etc. The vaccinations, injuries, and other causes are when selecting the medicine to remove the fundamental cause of the disease. That is the fundamental miasmatic obstacle to recovery. That is the fundamental miasmatic pattern. The other is the status miasmatic pattern. In selecting the constitutional prescription, considering the quality of the prescription according to the miasmatic viewpoint, we can select the apt status miasmatic prescription. That's the real miasmatic remedy. Obstacle to recovery others are cyst of Endomoeba histolytica or ova of roundworms or threadworms or other intestinal parasites, diabetes, hemoglobin in low level are also obstacles. That is why I prescribed ferrum phosphoricum 3x. Formerly I said, and also the acidic pattern, acidic quality of the body can reduce with the natron phosphoricum regular with the support of constitutional medicine. External application temporarily tone the skin rose, red or dark. At times, even blisters are formed. After sometimes the skin again turns to white. Ayurveda physicians have been using Bauchi or Babchi, Sorelia for centuries externally as well as internally. The Unani Hakims also used a plant called Ammi majus. So both are, we are using the Ammi versinega. It's also from that family. From the homeopathy, some sample cases. Case number 1, the Vitiligo case. Case of Hari Krishnan. The symptoms I observed was introspection, fear alone of being, laziness, indifference to loved one, dictatorial, contradiction disposition to hot and thirsty. The explanation needs much time of each rubrics, but I am not going through that. Just saying introspection, we can perceive that how the rubrics come, fear of being alone, or also laziness, indifference to loved one. That is, he is very behave indifference to the family members, the mother and to the brother. He behaves very indifferently, but he behaves very close and lovingly to the others. That is, it's taken indifferent to loved one. Dictatorial, contradiction disposition to hot, thirsty. But for the repetization, I took the first preference for indifference to loved one. Indifference to loved one is a syphilitic symptom. So I gave preference to that rubric. Second is introspection. It's a psychotic. Then dictatorial is also psychotic. Fear alone of being is psychotic. Laziness is also psychotic. Contrary disposition is also psychosyphilitic. The remedy comes phosphorus, sepia, and Merxol. Then I prescribed the medicine. The changes was after a few months. This is after years. Takes to cure from the face to downwards. Face first completely repigmented, then the hands, elbow, then the lower limb. The medicine I given was the start with the Merxol 6 because from the repertory chart, the third position, Merxol comes the third position. But this person was hot because phosphorus is chilly, sepia is also chilly. The medicine comes in hot pattern is thermal reaction is Merxol. And also the child was very much very on the obstinate and revolting type behavior. So the medicine confirmed. He is come from a classical homeopath from Kottayam. So I prescribed, because of that, I prescribed Merxol 6. Most of the classical homeopaths prescribe the constitutional medicine from 200th potency and above. So my logic was this Merxol is very easy to select by a classical prescriber. So I start that, I fill that gap by starting the Merxol 6 potency. The pigmentation starts. Now the person is moving on CM potency. They are little coin-sized patches only to pigment on the angle of the leg. Case number 2. So big patches on the forearm near the elbow. There is also much patches. The case of Mr. D. Excitement of mental exhaustion, excitement, aggravation, mental exertion, aversion, some home desire to go, responsibility, aversion, secretive, thoughts compelling, mood changeable, thinking complaints, aggravation, sleepless night, sleepy daytime. Those are the symptoms that observed from the filtered symptoms that observed from that person. Thoughts compelling. It's a syphilitic rubric. The first importance given for the rubric, thought compelling. It's nearly an OCD. OCD is also comes under the syphilitic pattern. Then nerves, excitement, nervous. It's a sorrow psychotic. Then when also sorrow syphilitic also. Excitement is also excited, trigger to the syphilitic range. That also comes sorrow syphilitic. Then mental exertion, aversion to homesickness. It's psychotic. Then secretive, also psychotic. Mood changeable, sorrow syphilitic or soric predominant. Thinking complaints, aggravation, thinking of the complaints. Then sleeplessness, night sleep thereby. The medicine comes was lachesis, staphysagria, ignatia, causticum, phosphorus, nitric acid, aurum, and natriuretic. The patient is hot thermally, the lycosis is hot, but the behavior or the disposition of the patient is not matching to lycosis. Lycosis is very extroverted. Lycosis is much loquacious, and lycosis is manipulating, and so many other symptoms are the characteristics or the predominant symptoms or not covers lycosis. But the metriomedica more close to natriuretic because the person is very secretive, very introverted, homesickness, etc. Then thinking of the complaints aggravation, all those symptoms are more by searching the metriomedica aspect. Natriuretic comes the best choice of the but it is in the first, second, third, fourth, fifth, the seventh position. But the natriuretic was my prescription. The pigmentation starts and it is almost disappeared. Natriuretic from 200 potency upwards was the prescription. Case number 3. This is a case of vitiligo patches. The only one patches I showing. The other also in the chest also. Chest under the clavicle, he manifested vitiligo patches. So Master P, laziness, desire to TV watching, play in mobile. Then he is extroverted, anger easily but suppressed, untidy, complaining that he is not appreciated, hot, food desire for sweet and beef. These are the symptoms filtered from the totality. Rest of the simply the medicine comes. I'm not showing the repertory chart. Simply the medicine comes the phosphorus. Phosphorus given in 200 potency, then 1 there is no change. Then I prescribed carcinosin 10 from the family history and the other fundamental pattern. To remove the obstacle recovery, in that concept, I give a dose of carcinosin 10 1 dose. But after observation, some period of observation, there was no improvement. Then, on the way, he affected with the fever, and the remedy prescribed was arsenic alb 200 potency. The fever got relief in an ideal way. Surprisingly, the high fever comes in control. So I think of arsenic alb, the good role of arsenic alb in his constitution part. So when we consider the constitutional symptoms, out of the disposition other than the acute pattern, that is the constitutional part, the most of the symptoms cover the sulfur. It was sure. Then I think of little more. I cross-checked that the person that formerly I observed that the person was hot, but when more I interrogate to find the person is not extremely hot, or he's not towards hot, but he is ambithermal. That he is using fan and same time he use covers, using fan and cover, and very closely observed each and every points to differentiate the hot and chilly. I comes in a conclusion that he's an ambithermal person. So the ambithermal sulfur is arsenic sulfide. And the other clarification, other strength that given to prescribe the arsenic sulfide was in acute condition. The pattern of symptoms that elevated to prescribe an acute remedy was arsenic alb, and it was miraculously, wonderfully heals the person in acute case, because I took the combination of arsenic and sulfur and give arsenic sulfide 1 to 10 potency. Now the person is improving totally disappeared, and almost 90% of the 95% of the other vitiligo patches under the clavicle is also disappearing. Case number 4. Mr. S, development of a new symptom as vitiligo during the treatment of rheumatoid arthritis. This is a strange case, but the person is not coming to my clinic for the treatment of vitiligo. She is coming for the treatment of rheumatoid arthritis of a years chronicity. After allopathic, Ayurvedic, and other homeopathic treatment, he approached me for the treatment of severe rheumatoid arthritis, and he was suffering from severe pain of the joints. The pattern of symptoms that selected was anxiety, health about on health once, and offended easily, fastidious, pain, rheumatic, communicative. These symptoms only observe. I can observe these symptoms only from that patient. Then prescribed the medicine. First, the carcinosin. Carcinosin, I prescribed first carcinosin, and the phosphorus comes. Then the person is hot directly, and some suppressions is there. Not the person is not diffusing like phosphorus. So I prescribed arsenic alb, 1 potency. But all the skin, all the rheumatic problems is disappear. It slowly vanishes. The patient feels better. Person have satisfied with the pain. At the same time, the lady around 40, in between 40 and 45 years old, she communicated to me that this vitiligo patches is not a problem to me, because it is not much trouble to me, but the pain and the swelling and the inability to work was much disturbing to me, to my life also. So this is not much trouble to me. But when this is a new symptom, according to a homeopath, this is a new symptom. In his lifetime, this vitiligo patches on the lips is a new symptom. So appearance of new symptoms we cannot avoid, we cannot neglect, because I consider this as, again, the former pattern. I consider the anxiety, health about, offended easily, fastidious, pain, rheumatic, communicative, plus skin compliance in mucocutaneous borders. It's also, again, it is considered. So that also consider, when that's the former pattern, consider the new symptom to that pattern, the compliance of the mucocutaneous part. Sulfur comes the first remedy, or the only sulfur comes as the first remedy. So the treatment with the carcinosin, I give support as supportive remedy, sulfur 6. Gradually, the pigmentation of the lip also pigmented, and slowly it is vanished. Case number 5. Mr. G, when he comes for treatment in forefront, he explained his numbness and formation of the upper and lower extremities with abnormal changes in blood pressure. That's his BP was 130/110. It's an perverted BP picked up. He also complained of some respiratory disorder on and off. Because of this BP, this perverted BP, may be due to that respiratory distresses, may be due to that pressure pattern. I had noticed some vitiligo patches under his chin, but he did not tell it as it is disturbing one. So I also give less importance to that vitiligo patches. As usual, my prescription was focused on the major, spelling mistake is there, major ailment and the more destructive ailment, the perverted blood pressure. First prescription was Digitalis 200 daily for few days. The BP comes to an almost normal 124/82 with some relief of his numbness, fumigation too. Then that complications got relief. He starts in complaining on his white patches under the chin. Then from the details of the case, I selected one constitutional medicine and applied along with the former medicine with the Digitalis, because I dislike to withdraw Digitalis, because the BP is a dangerous condition. The diastolic pressure is very much heightened, pulse pressure is low. The systolic pressure is also 130 only. The vitiligo patches were in the chin like this. The symptoms observed from the person were sadness, fortune from reverse off. He gone abroad for job, the agent cheat him, and he has to return from there, and some amount of money is lost for that purpose. So the condition I observed, the sadness, fortune, reverse of, grief, deception from, then contradiction, disposition to contradict, anxiety, conscience, anxiety of, injustice cannot support, heart complaints of thee. I took the rubric heart complaints of thee because of the not take the hypertension. I took the most deeper, and if the problem is there, the most destructive symptom, but not, it is not specific, so it is considered, but the organ wise it is a deeper organ related to the cardiovascular system. I prescribed heart complaints of, there is a otherwise there is a chance for suppression. So this pattern, according to this pattern, the medicine comes for ignatia, sepia, causticum, lachesis, natronur, etc. But in Materia Medica close to causticum because of his where the injustice cannot support is very predominant to that person. Because of that quality, I prescribed causticum. So causticum 200 and above potencies without any improvements. Then use one dose of syphilin 10 mg. One dose had no changes. After that, I gave anti-fundamental miasmatic remedy used as a fundamental miasmatic remedy, nosod, syphilin 10 mg, according to his the past history and parental history, to eliminate the obstacle recovery fundamental miasmatic obstacle. I one dose, there is no change. After that, I gave Unni Veliyath 10 drops in 5 ml glycerin to apply externally once daily for few minutes and rub off. Into 2 weeks, I gave a small 5 ml bottle of glycerin plus 10 drops of Unni Veliyath mixture to apply on that patch with the continuation of the without the changing the causticum for only for 2 weeks. Tiny spots of pigmentation starts to appear on that vitiligo patch. Then I advise to stop the external and continue the constitutional medicine only. Now the improvement is steady and satisfactory. That external application for a short time, I noticed the external application for the 2 weeks of Unni Veliyath helps to trigger the pigmentation of that area. After that, the constitutional medicine alone is need to complete the treatment. The pigmentation is beautifully pigmented. The only single, the completely gone picture is in my computer. Failed to upload because of some other problems. Case number 6. Mr. S, 44-year male, vitiligo patches on the face, lower lip, tip of the penis, starts on right side, chin 4 years back. Had allopathic treatment, homeopathic treatment, Ayurveda treatment without changes. Creeping sensation on the face with which compels to rub before and after the appearance of the discoloration. Married 15 years back, but no issue. Distended abdomen with gas and sensation of lump in the throat. Swelling, swallowing made difficult. Past history of mumps, urinary tract infection. Family history of father died 11 years back, diabetes mellitus, brain stroke. Mother hypertension, heart disease. He is a 6th member of out of 10 of his family. 4 members died in early infant period. Hunger normal, food all desires, taste is all desire. 2, thirst. 3, perspiration profuse. 4, salt crystals from over skin, forms over the skin after perspiration. 2, odor offensive. 2, stool normal, urine odor offensive. History of urinary tract infection. Thermally, he is hot. 4, mark, he is very hot. Male, history of surgery for varicocele, for oligospermia. Extremity pain, knees and other joints. Skin, history of itching, eruptions of fungal part, inguinal part. Sleep, satisfactory. Sleep position, right side. Dreams, elephant chasing, 3. He's repeatedly seeing the dream, elephant chasing. Frightful, weep, unsuccessful effort in. Prophetic dreams also. Some other dreams also, his wife also mentioned. Some the dreams he communicate to her also happens later on. Mind, she is very religious. He's have a family kshetra, family temple on his property. Had an unfortunate incident of scorned by daughter of elder brother for some family issues, some financial partition issue. Daughter of his elder brother scorned him. He and his wife had loved her very much as own daughter. That made him much sad and depressed. He had not reacted by utter even with a word till this day. All anger suppressed with a hatredness. Basically, he's a mild and soft-spoken person, but if angered, he reacts violently. Only 3 rubrics first I taken for repertory. That's ailments from rudeness of others. He was very much affected with that the rudeness of the daughter of the elder brother's daughter. Hatred person offended him. Hatred of person who, because after that incident, years after he disliked to even utter a word to that girl. That's he forms a hatred to that girl after that. Then dreams prophetic. The remedy comes to us, phosphoric acid, only single mark for all remedy. There are no other medicines covers. The remedy was phosphoric acid. For the clarification or the detailed cross check of the remedy like this, dreams frightful. It's not added in the repertory. The dreams prophetic is added. It's a syphilitic symptom, so I add only 2 syphilitic symptoms, 3 syphilitic symptoms add for the repertorization. The other symptoms are try to cross check with the identified remedy. That's the way of another way of selecting medicine. Then I check that dreams frightful. Phosphoric acid comes again comes 1 mark. Then delusion despised. The means to regard as worthless or to look down upon with contempt. That it was the incident he happened from the from that girl. Because this give more important because the vitiligo patches begins after 3 years, 2.5 to 3 years after the this incident happens. Then delusion despised, phosphorus comes, not phosphoric acid, but the phosphorus person have much hatredness and he hold the hatredness for long period. The acid remedy comes, it is phosphoric acid. So again, another powder given. It is a classical single remedy prescription. Phosphoric acid to 1 dose powder given. The pigment. This is the former slide before the pigmentation. Here the pigmentation begins to start with the phosphoric acid 200. No repeated. Had not repeated the remedy. The beautifully pigmenting, then it's completely disappeared. So totally with the single dose of phosphoric acid. The remedy is apt, there is no repetition. If the remedy is not apt, there was some obstacles. Sometimes we need, and in my experience, I'm not using much external applications. Sometimes the external medicines for a short period just to trigger the improvement, then avoid the external application. Only with the constitutional medicine can complete the treatment. Case number 7. So just only pictures. I'm not detailing the case because there is because the lack of time. There's patches in the lower limb. So pigmenting. Then case number 8. This is also a lady comes for rheumatic problems and other problems in an aged lady about 70. By the constitutional treatment, the pigment is the lower lip is also gradually pigmenting. The case number 9, so another case, it's also pigmentation. Then 10, case number 10, say in the lips, it's also pigmented. These are the cases that I interested to care. So already cover 1 hour. Then thank you everybody for listening me. Then you can share your experience and knowledge about vitiligo to this platform. That also enrich my knowledge and others too for the better sharing. Thank you.